Welcome to the Brilliant Fertility Podcast. I'm your host, Dr. Katie Rose, and this podcast exists to help illuminate the path ahead of you. With expert interviews, clinical pearls, and real client success stories, my intention is to bring you hope for what's possible on this journey and to give you tools and resources to navigate the ups and downs on the road before you. If you find this podcast helpful, don't forget to subscribe on your favorite listening platform. And I have a big request. If you have a minute, can you leave us a 5-star review? And let us know, what did you learn? What did you come away with? Did you leave with that spark of hope? This helps more people like you find the podcast. My mission is to support as many humans as possible on their path to become parent. And by you sharing and subscribing, you're part of that mission too. And I'm so grateful for you for being here. Welcome back to the Brilliant Fertility Podcast. Today, we're talking all about thyroid hormone. Now, I cannot underestimate the importance of thyroid health and how active the thyroid hormones are when it comes to fertility. Really, every stage of this journey, from ovulation to a healthy luteal phase to implantation to early pregnancy growth, is impacted by thyroid hormone. And while it's routinely screened for, I will argue this to the grave that most providers are not doing in-depth investigation of thyroid hormone in a way that is truly meaningful. So let's dive in. As a person who has been diagnosed with Hashimoto's and hypothyroid, this is very near and dear to my heart personally. And I believe that this was really a big part of why my hormones were so wacky for so long. But you know me. Well, if you've been listening to this podcast for a while, you know that I'm not just going to keep this on the physical front. The thyroid has an energetic and emotional component as well. So of course, we're going to be diving into that. But let's start with where thyroid actions are important. And maybe we'll actually start with, what is the thyroid gland? So it's this little butterfly-shaped gland that is at the front of the neck, and it produces thyroid hormone. Thyroid hormone has receptors in many other organs in the body. And when it comes to fertility, it has a big impact on ovulation. It has an impact on the health of the luteal phase and being able to produce enough progesterone. And then as soon as a pregnancy is detected, our thyroid hormone activity should increase by 30 to 50%, because we need thyroid hormone for early pregnancy growth until the baby's thyroid takes over. So this is why it's so important. And I think it's also really important to discuss the immune system as it relates to thyroid, because the vast majority of women who are diagnosed with hypothyroid actually have Hashimoto's. And Hashimoto's is an autoimmune condition, and it can often be detected prior to someone actually becoming hypothyroid. So I think we have to differentiate, at what point is this an autoimmune issue versus a hormonal issue versus both, and why the typical screening process misses the immune factor altogether. So how is the testing typically done for thyroid? It's really common to see TSH, which is thyroid stimulating hormone, tested on a prenatal screening. If anyone has had, a complaint of irregular periods, I often see TSH screened, and that's it. And if TSH is normal, they kind of call it a day and say, well, it doesn't seem to be a thyroid issue. And this is where we really need to be thinking about this differently. So TSH is coming from the pituitary gland. It's telling the thyroid gland in the neck how much hormone to make. And there's a little bit of fluctuation of TSH throughout the day. So, number one, we have to make sure that ideally we're testing this in the morning, fasted. If someone is taking thyroid hormone, I usually have them skip thyroid hormone on the day that they do their blood test. And, when I talk to my patients who have been treated for thyroid in the past, they usually say, oh my gosh, no one's ever told me that I should go fasted in the morning and skip my meds. So I really do like to have some consistency across the board when we're testing thyroid hormone because of that fluctuation. And we have to go beyond just that TSH. Truly, we need to see how much of that hormone is actually circulating in the body. So, how much is being produced by the thyroid gland itself. And that's looked at in T4 and T3. So, primarily the thyroid gland will be producing T4, and it also produces a little bit of T3, a little bit of T2, T5, but really we're usually looking at T4 and T3. T3 is really important because this is what actually has metabolic activity. And if we aren't making enough T3 or our cells aren't receptive to thyroid hormone, this is where we get into that situation where people can be symptomatic. They can have hypothyroid symptoms, but their TSH could still look normal because they show to have enough T4. And this happens for people who are being treated for thyroid as well, and they're being medicated with Synthroid or levothyroxine, which is straight T4, if they're not converting that well. So I'm getting a little bit off track here. I'm going to go into medication in just a few minutes. But with that screening, you can see an example of the labs I run in my patients. If you head to the show notes, you can download the free fertility lab guide. This will show you everything that I typically order on my patients, what time of the cycle I order them, what marker is related to what, and how the optimal ranges should appear, not just the normal ranges. Because, for example, with thyroid, the normal range is 0.45 up to 4.5. That's a pretty big range for a hormone that has such a significant impact on fertility. And there are several studies showing that an optimal range for fertility is really between about 1 and 2.5. So if TSH is above 2.5, or if it's in this sort of gray zone of 2.5 to 4.5, there's not really a standard of care in Western medicine for what to do with that range. Most doctors will brush it off and say that's normal. Some fertility specialists, reproductive endocrinologists are really taking this more seriously. And if it's in that gray zone, they'll just start recommending the medication right off the bat. I still like to dig a little bit deeper and understand like if there are thyroid antibodies. So usually my screening panel for thyroid is a TSH, a free T3, free T4, thyroid peroxidase antibodies, and thyroglobulin antibodies, because I really want to understand if the immune system is active in a sluggish thyroid or poor thyroid health. Because the immune system involvement is also really important for understanding what's happening within the endometrium. And when the body is already producing autoimmune antibodies towards its own tissue, there is a concern that could increase the rate of miscarriage. It increases the inflammation in the body. So if someone has had a previous miscarriage or a family history of thyroid disease, and we can catch those antibodies sooner, there is a lot that we can do in that scenario. And I know that also differs quite a bit from Western medicine, where they often won't even test the antibodies because it's not within their toolbox to do anything with that information. And that's a big frustration among us Hashimoto's warriors, is that you go in, you get diagnosed with hypothyroid, and you say, what can I do about this? And they say, well, you take your thyroid medication, and that will replace thyroid hormone if you've had enough damage to the thyroid gland that you're not producing enough hormone. But it doesn't address why the immune system started creating these antibodies and destroying the thyroid in the first place. So my soapbox on that piece and how it's addressed in Western medicine, it is really frustrating. And I know it can be challenging to get some providers to order labs that they might deem unnecessary, or like, why would we order that? There's nothing we would do about it. So trust your gut on this. If you feel that you need more information, if you feel frustrated that you're not getting a change in results with the treatment that you have so far, thankfully, we've got lots of good people, lots of amazing practitioners in this area who are well suited to treat autoimmune thyroid issues. So, what symptoms are we watching for if we suspect a thyroid issue, especially if their labs have been told they're normal? We have the stereotypical symptoms with hypothyroid, and hypothyroid is a lot more common than hyperthyroid. I'll start with hypo. Hypothyroid, typically we'll see everything kind of slowed down. This means fatigue. This can mean weight gain. This can mean brain fog, muscle soreness, joint aches. Sometimes we'll see hair loss or hair breakage, like brittle hair, brittle nails, dry skin, sluggish digestion, often constipation. And we can see irregular menstrual cycles too. So some people will have a more stereotypical picture where they have heavier cycles with a shorter cycle length. So, 24 days or less. My picture with hypothyroid was actually anovulation. So not having a normal ovulatory pattern that would lead to extended cycles, and that can overlap with PCOS as well. So there can be some sifting through that we need to do to understand like which factor is really playing into a long cycle or an anovulatory cycle. But because thyroid hormone does play a role in the follicular phase in supporting the pituitary's communication with FSH and the ovary to get that follicle ready and get that egg going to ovulate, we will often see anovulatory cycles in people with hypothyroid. Unexplained infertility, that is a symptom. And that's why I really shy away from this diagnosis with unexplained infertility, because so often I will pick something up, and a lot of times it's thyroid hormone. I mean, I'm just thinking back to like the few most recent positive pregnancy tests that we have in my practice and in the Brilliant Fertility program. And 3 out of 5 of them had what we would consider a subclinical hypothyroid picture, where they have that TSH between 3 and 5. They had some kind of vague symptoms of hypothyroid, maybe some decreased energy, a little bit of weight gain, slightly irregular cycles. And all it took was supporting thyroid hormone. Also, we're always working on the emotional and the mental and the spiritual. So sometimes it's hard to know like the exact piece that really made the biggest difference, but it does appear to make a big difference in my practice. And there's at least a handful of people every single year who, as soon as we address thyroid hormone, they get pregnant. So what about hyperthyroid? So this is when we're producing too much thyroid hormone. I've had the pleasure of, with how my Hashimoto's has played out, of experiencing both hyper and hypothyroid. So I can tell you from experience that neither is fun. Hyperthyroid, we will often see things kind of sped up and hot. So some heat intolerance, hot flashes. Oftentimes we'll see unintentional weight loss. We might feel anxiety, or it's not a typical anxiety where it's the mental thought spiral patterns. It's more of like this internal vibrating from the inside out experience of anxiety. We might see increased bowel movements, increased frequency of bowel movements. We can still see hair, nail, and skin changes. Still with brittleness and hair loss. With nails, it can often be like a thinning of the nails, having like more flexible nails. That was an interesting experience that I also had with the hyperthyroid picture and also irregular cycles. So, usually trending more towards scantier periods, lighter periods, and still can have anovulation. Now, hyperthyroid, it is really important to get into an endocrinologist and screen for thyroid nodules and toxic multi-nodular symptoms with thyroid. Sometimes we really do need to get medication on board quickly to get thyroid hormone down into normal ranges so that we can protect the heart, because hyperthyroid can cause stress to the heart. So there are absolutely situations where I am supporting someone with their thyroid while they are simultaneously seeing an endocrinologist. Like, I don't knock Western medicine. I just really want to make sure that we have a thorough understanding of why someone's thyroid picture might look the way it is, and that we're addressing the immune system and not only the thyroid hormone piece. So I think that does lead to a question of, when do we medicate? And when do we just use supplements? And when might we use both? So I do obviously talk all of my patients through the risks and the benefits and give informed consent about all of our options. If someone has a TSH above 4, that is when I personally will usually start prescribing thyroid hormone medication. I personally take thyroid hormone medication, and I have for, gosh, I want to say it's been since 2013, so 11, 12 years now. With the exception of postpartum, when I was hyperthyroid, I actually got to take 2 years off of thyroid hormone. And so we do follow this closely. So I check in with my patients once we've started medication. We will retest labs in about 4 to 6 weeks, make sure that that TSH is coming into normal range. But I don't just leave it at that. Like, we're addressing the lifestyle factors that can impact thyroid health. We're addressing other nutrients that impact the immune system and how well someone converts their T4 to T3. We're addressing stress, which has a big impact on the thyroid gland. And when it comes to supplements, like, I do tend to tailor to the individual, but there are some situations like with Hashimoto's and elevated TPO antibodies. Like, there are studies showing that myo-inositol and selenium and glutathione can bring thyroid antibodies down. And so those are 3 common supplements that I will use. This is not medical advice. This is just what I tend to do in my practice. So please talk to your doctor before you go starting any supplements. Those are the most common ones that I used in Hashimoto's. But oftentimes we're also looking at nutrient deficiencies like iron and vitamin D, other fat-soluble vitamins that play a role in thyroid health, and amino acids, because we do need amino acids like tyrosine in order to produce the thyroid hormone itself. So there's several factors to really look at. I do think it's really important to be with a practitioner who has a good understanding of the layers of thyroid health and the immune system, so that you can have a really tailored approach to that. But what about the people who are really hesitant to take medication? And I've talked to patients before who say they've been worried about their thyroid. We finally test it, and it's in that gray zone, and they're like, oh, like, I don't want to end up on a medication for the rest of my life. And I will say, I've had many, dozens of scenarios where people have not needed to be on thyroid for the rest of their lives, because it was a situation where we could understand, we could pinpoint what had caused an issue with their thyroid in the first place. They may have needed it through the preconception fertility journey into pregnancy. And then after pregnancy, we were able to continue working on things and wean them off thyroid hormone. And they've been stable for years. And then I have people who, because there's been a certain level of thyroid hormone destruction, like, it is just a really good idea to stay on it for long term. And that doesn't mean that we can't heal. I think there's so much untapped possibility in the body, and there's really so much potential when we believe that we can heal, when we give the body the nutrients it needs, when we remove the obstacles to cure. There is just an unlimited level of healing that I think is available to us. And sometimes, like, it's going to take time to work through some of those. Like, I have a personal goal of getting off of thyroid hormone at some point in my lifetime. And I also know that right now it helps me function so much better than without it. I mean, this really is a thyroid or a hormone that we need to survive and thrive. So I'm pretty adamant that, if we have TSH levels over 4, that we do treat thyroid hormone, and that, I will give people a timeline of about 2 to 6 months if they're in that gray zone to be checking in on it and using other tools to optimize their immune system and thyroid health. But I don't mess around with it because it makes such a difference when we have optimal thyroid health. And then you guys know me, like I'm going to get into the woo of the thyroid a bit because I've just witnessed too much in this world, and we know that there is this energetic element to all of our organs, and the thyroid being an endocrine organ, meaning it's secreting hormones, it has a different energetics as well. So let's bring in the woo here. The thyroid is in the throat chakra, right? This fifth chakra that is the center of communication and expression and creativity. So if something is going on in the throat area, if someone has thyroid issues, if they've lost their voice, that's another symptom of thyroid issues, by the way, is hoarseness of the voice, feeling like to clear the throat a lot, feeling like there's like literally a blockage here if the thyroid is swollen. But if there's something else going on there, like if there's a vocal cord issue, if there's just unexplained like tension in the throat, I'm also asking if there's an emotion that is being suppressed, if there's an issue with communication, if there are needs that you have that are not being met because you cannot express those needs. That's really, really important to address. And I'll give a personal example. I'm pretty sure she'd be okay with me giving this example. And this dates way back to 2009. My mom at the time she was still in pharmacy. She was the pharmacy manager at a big hospital. There had been big administrative changes within that year that were just, it was not a good working environment at all. And she had been walking around with, I'm gonna skip ahead a little bit because I don't want to give too much away without a good story. I'll start with, I was in my year off from like in between undergrad and choosing to go to naturopathic medical school. And I was exploring my options and really wanting to make sure that I was making the right choice and the best choice and a logical choice. Right. So I was kind of fighting between my ego and my intuition that year. I had an opportunity to attend a naturopathic conference as a student for free. And I thought, why the heck not? Like, this will give me a better idea of what I'm getting myself into if I choose naturopathic medical school. So I dragged my mom up to the conference with me. And mind you, even though she had worked in Western medicine for decades, she was pretty open-minded. And I was still pretty skeptical, even though I'd seen such good results for myself in the chronic health issues that I'd been dealing with. I was still like, I don't know, like, is this legitimate? So we go to this conference and we stop at this booth where the only way I can describe it is this woman had like this scanner that was like a wand that measured frequency that she'd run over the body. And it felt so Star Trek to me, you guys. I was like, this is bullshit. Like the skeptic in me was like, this is just wild stuff, but I knew some of what had been going on with my mom. And so we stop at this booth, we're having a good time. And this woman is scanning and she gets back to the throat chakra and she's like, wow, there's like a really strong blockage here in the throat chakra. And my mom and I are just kind of side-eyeing each other, like, oh my gosh, like what is this? And what this woman didn't have any way of knowing is that my mom had been having thyroid issues. She'd actually developed swelling of the thyroid gland a few months earlier. And it was a rather alarming situation, actually, that she was being worked up for, that they hadn't really discovered a cause for why her thyroid was like swollen and enlarged and inflamed. And this woman was like, well, the thyroid gland or the throat chakra is associated with communication. So if there's anything that you've been holding back, it might be worth exploring that. We never did end up telling this, random Star Trek scanning lady that there was something going on with thyroid. We were just kind of like, ooh, okay, we may need to go talk about this. But my mom had actually been walking around with her letter of resignation in her pocket for something like 2 months. Like she was so ready to be done with this administration and how, terribly they treated their employees. And when she finally did end up resigning from this position, pretty rapidly, this thyroid issue resolved, and it has never been an issue since. So that was really my first experience. This was 15 years ago of going, oh, wow, like maybe there really is something here. The body is trying to communicate what we can't, right? And we've talked about energetics before on this podcast. I think I've expressed how importantly I feel it is that we're in communication with our body and that we trust the wisdom of the body, that we're on the same team. So when we have something like this coming up with thyroid issues being so prevalent, like, yes, I'm investigating the labs and nutrients and environmental toxins. My goodness, those absolutely play a role. We've got our forever chemicals and our fluorides, and that makes a difference. And like communication and our ability to express ourselves authentically is something we are going to need now more than ever. It's also important to understand that the fifth chakra, the throat chakra, has a really powerful connection to the sacral chakra, which of course then houses the reproductive organs. So both are a seat of being able to store emotions and creativity. And so when we start to be able to express ourselves and have that authenticity and speak our truth, we are actually opening up an energetic line to the reproductive system as well. So to leave you on that woo note, just getting thinking, if you've suspected you have thyroid issues or have been diagnosed with thyroid issues, that in addition to addressing the physical needs of the thyroid and the immune system, we want to better understand what the body is trying to communicate as well, and ask, what do I need to be able to step into my authentic truth and to speak my truth? And what do I need to feel safe doing that? And so much of that has come from the work that I've done with clearing emotions, with finding safe spaces, safe community to have communication and expression with, and finding a creative outlet, finding something that really does bring you joy and, sparks that level of creativity in you as well. That's going to look different for every person, but just starting to get curious about what that could look like for you can be a really beautiful part of the healing journey. So let me know what questions you have about thyroid. Shoot me a DM on Instagram or send me an email. at info@brilliantfertility.com and let us know what you learned about in this episode or what questions you have about thyroid hormone. If you took away anything valuable from this episode, take a moment and rate and leave a review for the podcast. This helps us get in front of more listeners. And with our mission of helping as many people as possible have healthy babies, healthy pregnancies, a healthy parenting journey, it means so much to me when you share. All right, here's to a healthy thyroid gland, and I hope you have the best day ahead.